Welcome, and thank you for attending Biohackr University. We are happy that you could join us. Please have a seat, and our course will begin shortly.
Hi, everyone. Welcome. I want to welcome you all to our first Biohackr University Introduction to Biohacking 101. Thank you all for joining on the webinar as well, and thank you all for coming in person. I'd like to introduce our CEO and Medical Director, Dr. Lori Bluvis. She's going to just say a few words about biohacking, and then Dr. Greenberg is going to take over. So, Dr. Bluvis.
Thank you. So first off, I just want to thank my partner Atusa Habibi for keeping our clinics up and running and planning all these events for us. You know, I really, really appreciate you. So I want to make a point of that. So Dr. Greenberg and I have known each other for 25 years. We met in 1999 when we were starting our private practices, she in plastic surgery and me in OBGYN. And it's a lot to be a board certified physician and to run a private practice and to raise children. And I'm kind of surprised, but we did make it through those survival years. And here we are. As with a lot of you, there's a lot of evolution and a lot of changes, and medicine is great in that it's evolving and changing, but sometimes these changes, they don't look so good and maybe they don't feel so good. And so as this started happening to Dr. Greenberg and myself, we became more interested in this space of longevity medicine and how we could age better. So to talk about her journey, I would like to introduce Dr. Lauren Greenberg. She is a board certified plastic surgeon. She did her residency training at Stanford University, followed by a fellowship in cosmetic and breast surgery. And in the last 10 years, she has been using a lot of stem cells and fat grafting in her surgical practice. So she has witnessed firsthand seeing this age reversal that is happening with stem cells, which made biohacking even more interesting. So she's bringing science to this world of biohacking medicine and developing our programs here at Biohackr to make them actionable and affordable so that our clients can age better and can understand what their true risks are of disease. So thank you, Lauren. All right.
All right, so welcome, and I'll go through all of this. You have little notebooks if you want to write questions, but I think that we really want this to be an interactive thing and address what it is that you really like or what you want to know about. So I have gone to school for way too many years, and that is how we end up here. But one of the things that I think is important is that all of the stuff that I'm going to talk about is stuff that also applies to me. So this really started organically with me wanting to age better. As weird as it is that I'm a plastic surgeon and it's this biohacking space, every year we have an article in our journal that is the science of aging. And they talk about mitochondrial health, they talk about telomere length, they talk about stem cells. And so you don't think of plastic surgeons thinking about that, but a lot of anti-aging things stems from stem cells and anti-aging. And so that is part of what got me into this. I do a lot of fat grafting, I do it to the face, and you can actually see the skin quality improve, the collagen and elastin improves. You can prove that with histologic biopsies. And so that kind of got me into this space. Anti-aging is a general giant term, and you will hear things like health span and lifespan and longevity and what does it all mean? And I think that that is a really important thing to kind of look into. Health span means how long are you healthy? Lifespan means how long do you live? And in the United States, we have one of the longest lifespans, but we have one of the biggest gaps between health span and lifespan. So we have long life, but the last part of that life, we aren't healthy. We can't move well, we have diabetes, we have some kind of impairment. So you're not able to kind of live your best life. And so the real goal with this is to try to improve your health span so that you can enjoy more of your life longer. What are signs of aging? We all know these, but just to kind of touch on some of them. Weight changes, super common. sleep, brain fog, hard time finding words, leading down the road to dementia, joint pain. If anyone exercises, we all have something that we're wearing a brace for to protect. Bone loss, osteopenia is a huge issue, especially as you get older. Sex issues, dryness, all of those kinds of things, libido, skin quality, that again is something that I see a lot in plastic surgery. It's part of why everything starts to wrinkle and droop when you get older. Hair loss, hair thinning. Anyway, and one of the things, so when you're looking at biohacking, I think there's some big picture things that I keep finding. So if you read all of the stuff on our website, all of the blogs, those are me. And when you look at how can I age better, you will find that everything is interconnected. As much as I want to think that brain health is different than cancer risk, is different than heart disease risk, they are all very interrelated. So when you're addressing one, you're really addressing a cascade of other things. I think it's also very important that you realize how individual it is. What my risk factor is versus your risk factor is totally different. You cannot throw the kitchen sink at everything. It's overwhelming. You cannot optimize every single silo of this because you don't have the bandwidth. It would be your full-time job to do it, and I don't think it's possible. And you will find that what appeals to you or what you need is going to vary from person to person, and so it's important to figure out what those things are. And the other thing that you find is that everything is very unique. And if you want to be good when you're older, you have to start yesterday, essentially. And so I think, anyone who's watching the webinar or who's out here who's, below the age of 40, good for you. Because these are things that if you start them, a lot of times you cannot reverse damage, but you can slow the aging process. Aging process is called cell senescence. It's when your cells get old and when they're multiplying, they don't do so well anymore. Your telomeres shorten. But if you can slow that process, you're going to slow your aging process. So one of the things that a lot of my friends have done is they go to some really fancy place, they spend $50,000 to $100,000 and they get all this testing done. Comes in a nice, beautiful booklet to tell them what their issues are. And so this is kind of an area where when we started Biohackr, I really want to bring science to this space and help people figure out what is their issue. But in order to do that, you kind of have to do a survey to find out what their issue could be. So is their issue cancer? Is it heart disease? Is it blood sugar? Is it dementia? What is the thing that they need to focus on? And a lot of times you may not know. Your family history will give you some indication, but you may not know. And so you can do testing to figure out what those are. And so doing this benchmark, instead of it being $100,000 and a fancy booklet, we are doing it in a way that is much more affordable and I think achievable for people to do, to look at all these different components. So cancer, we'll talk about briefly first. I had a patient who came into my clinic. At age 25, she had already had melanoma. And when she was talking about her family, there were tons of people in her family who have all had cancers at very young ages. Cancer is a big risk for this woman. And so how can she stratify that risk? How can she figure it out? So it turns out that you can do a genetic cancer risk screen. And everyone has, or not everyone, but the BRCA gene is one that everyone has heard of. Which has to do with breast cancer. And if you are BRCA positive, your risk for breast cancer is 50 to 80%. And the time that you get that breast cancer is younger. And so if you are BRCA positive, you know that starting at age 40, your risk for having a cancer is really high. And that's a testable thing. So you can test, see what your hereditary markers are at an early age. So at age 20, you could know, at age 40, I'm going to probably need to have a mastectomy. So if I want to have kids, I should do that sooner, or I should do a prophylactic mastectomy when I'm 35, so I never get to that point. So that's the one that everyone has heard of, but there are millions of them. We can test for some of those now. As time goes on, we'll be able to test for more. But they can tell you if you're at risk for colon cancer or pancreatic cancer or these other things, so that you know you shouldn't not do your colonoscopy, or maybe you should do it sooner. There is a blood test you can do called Galleri, which is also part of our benchmark. And that actually, when you have cancers, it can shed little pieces of the cancer into your bloodstream. So this takes advantage of that by looking at your blood to see, do they see those little pieces? If you do it and it's negative, it doesn't mean that you don't have cancer, because it's not all knowing yet. Again, I think these are things that are going to improve with time. But if it is positive, you're going to find out potentially much earlier than you could see it on a scan or something else that you have a cancer. Heart disease, #1 risk of death for men and women in the US. And I think that we focus on things like being a woman, you hear about breast cancer, or you hear about other things a lot more, but heart disease is still the #1 thing for men and for women. And so when you're looking at this, this is probably one of the only areas that's very modifiable by what you do. So what do you have that would put you at risk for heart disease? Is your blood sugar high? Are you pre-diabetic? Are you diabetic? Do you have cholesterol issues? And this isn't just LDL and HDL. I think that, you know, that is what's been used. And if you go for your general checkup, that's what you'll see with your doctor. But we know a lot more now. So apoprotein B is another thing you can get when you do a more advanced cholesterol screen. That has been shown to be more, a better correlator to what your heart disease risk is. Lipoprotein A. Who's here? Have you heard of lipoprotein A? Lipoprotein A is another testable thing that you do when you're doing a comprehensive cholesterol panel. It's genetic. So you can be super fit, super skinny, and be positive in lipoprotein A, and it doubles your heart disease risk. And so there are interventions that you can do for some of these, and you want to, again, do them early. And this is something where if your levels are normal, so apoprotein B, 100 is a normal level, but if you can lower it and you're around 50, it actually can reverse some of the heart disease that you have, or the atherosclerosis, the buildup in your arteries. And so diet, exercise, these are actionable things that you can do. The GLPs, which are Ozempic, tirzepatide, semaglutide, have an enormous impact actually on heart disease risk. And so for people who don't need it for weight loss in the future, we may be microdosing or doing other things to try and decrease inflammation and decrease the risk, because the studies are very compelling that that has an improvement in it. So all of these things are affecting it. Hormones for women, if you are postmenopausal, estrogen is a wonder drug and it lowers your risk for heart disease. So when you're trying to decide, should I do hormone replacement or not, that's something that you need to factor in. This one study, which I'll highlight, I love science, but in this study, they had 10,000 patients in Australia who were 40 to 65, no risk factors, none. And they did all of the scans on them to see what would they find. When they did a CT angio, which is where they put a dye into your arteries so they can see if there's blockages, 30% of them had heart disease. When they did a cardiac calcium scan, which is something that's in our benchmark, where you do a CT scan to look to see if there's calcification in your arteries, they found that 25% of them had a score above 0. And they found for each 10 milligram increase in apoprotein B, you had a 20% increased risk for heart disease. So it was a better predictor than LDL. And so, sorry, I said 50 before, but 40 or below is the goal. So if you can lower your apoprotein B, you're actually going to unclog some of this stuff and this clogging of your arteries, we talk about heart disease, but your arteries go to everything. It goes to your brain. So dementia and things like that. Not to get into the nitty gritty of it, but if you have issues with impotence, that is blood flow. So you don't want to clog your arteries anywhere because it's going to have effects everywhere. When you're trying to figure out what your risk for heart disease is, another thing you can look at is what's your body shape. We used to always talk about BMI, and you know if your BMI is high, you have obesity or you're pre-obese, and those are an increased risk. But there's a thing called body roundness index, and it's looking at your waist to your hip ratio. And everyone is seeing that person with the tiny little stick legs with the big belly. And so their BMI may be normal, but their risk for heart disease and metabolic syndrome, which is stroke, heart disease, and diabetes, your risk is much higher if you have a high body roundness index. So measuring your waist versus your hip is going to be a better indicator, again, of what things you should be focused on. Diabetes, I'm kind of obsessed with. And it's not for people who are diabetic, because I bet that no one in this room is probably diabetic. But pre-diabetes, or just kind of running a little rich in your sugar, is thought to be a kind of a global thing that affects every body system. So heart disease, diabetes risk, dementia risk, cancer risk all go up if your blood runs a little sweet. When you're pregnant, you do a gestational diabetes test. And a lot of women who test high for that are found later to go on to diabetes. And one of the things with biohacking, we talked about start early. The other thing that I really like about biohacking is that it's really much more about prevention. I think that modern medicine, and one of my frustrations with being a doctor, is that they wait till you have a problem and then they treat it. We aren't going to give you medications for diabetes or counsel you about that because you're not diabetic yet. Your hemoglobin A1C may be 5.6, which is on the upper border of normal, but you're not diabetic yet, so you don't need to worry about it. But you do, because it's not going to go down without doing some kind of intervention. And so this is something that I'm really focused on. Sugar is bad. And it's not eating sugar, it's how your body responds to it. And so we know objectively that this is correlating with lots of disease processes. If you just look at things, diabetics have higher rates of everything: infections, heart disease, dementia, cancer. We know if you put someone on metformin, which is an oral anti-diabetic drug, an anti-glucose drug, when you put someone on metformin, it actually has been shown to lower certain rates of cancer, skin cancer, breast cancer recurrence. When you look at the GLP medications, you will see that they reduce heart disease, dementia. Actually, the GLPs are really kind of amazing. I think that's my next slide. Yes. The GLPs are kind of amazing. So when they came out originally, it was really recommended for people who had diabetes, or if your BMI was above 30, or if it was above 27 and you had some kind of other medical issue. You had diabetes, high blood pressure, heart disease, something. And so all of these people started doing it, and all these people started losing weight. And so there are millions of people who now have been on these medications. And so there are lots and lots of studies that have been done. And when you look at those studies, it shows a decrease in asthma. It shows a decrease in knee osteoarthritis, irrespective of how much weight you've lost. Fatty liver is improved. There was a presentation at the International Alzheimer's Association showing a 30% decrease in dementia progression in people who were on GLP agonists. And so GLPs and metformin are kind of the anti-insulin resistance. And so when you see that if you address your blood sugar, all these other things get better, it really kind of drives home to me how important your blood sugar is. Some people call dementia type 3 diabetes. So these are things that you want to address, and you want to address them early. Continuous glucose monitor, one of the best things that's come out in I don't know how long. But this is a little thing that you wear. I actually have one. And I did this because I did it some months ago. And you will find that it's a very individual thing what spikes you. So in the past, it was carbohydrates are bad, they're going to spike you. It turns out carbohydrates are not all the same, and they're not all the same for different people. So for me, just to share with everyone, for me, if I eat oatmeal, it's bad. Doesn't matter if it's Quaker Oats, steel cut, some organic thing, always bad, spikes me through the roof. If I eat rice, and I actually did so the thing that's really great when you're doing these things is you can do little experiments. So if you put your rice in the refrigerator, studies show, I even blogged about this, that it lowers the glycemic index of the rice, so it shouldn't make me spike as much. It did not work for me. I still spiked. So if I go out for Indian food, which I love, and I'm eating, I should eat the naan and not the rice. Because for me, naan, which is bread, which in my head, I think rice is healthier than naan, but the rice spikes me through the roof, the naan does not. If you were wearing this monitor, it might be different for you. I just wore one. Yeah. For 2 weeks, for the same reason, just to experiment with, and the oatmeal did the same thing. Yeah. But everyone's a little different. I have one friend that bananas and potatoes made her spike through the roof, and that doesn't do it for me. And so there are things that you will learn about yourself, and I think it's really important to do that. So anyone with a hemoglobin A1C, and a hemoglobin A1C is a blood test that you do that tells you what your average blood sugar has been over the past 3 months. So if you've gone to the doctor's office and they tell you to fast after midnight and you get your blood drawn, they are getting one data point of your blood sugar, and they'll say your glucose is fine or it was above 100. You might, need to start watching things. That's one data point, one day in your life. Did you exercise yesterday? Did you eat pasta? Like, what did you do the day before could affect that. When you look at your hemoglobin A1C, it's looking at what it's been for 3 months. So that's a much better indicator of where you're at. And so that's really what we focus on. If it's below 5, your body's working. You are not having sugar spikes. This is not one of the silos you need to focus on. If your your hemoglobin A1C is above 5, maybe consider doing a CGM and see where you're at. If it's above 5.6, you need to. And for all the women out there, if you're close to menopause, menopause changes everything. And so you may have been fine for forever, and then you go through menopause and everything changes. And so now you really need to focus on it. So there are things that you can do. When you are eating, you can see a blood sugar spike. You don't want the spike. Especially if it's a fast spike, when it goes high quickly and it comes down, that sugar crash is what makes you want to eat again. So you want to have sugar curves that look more like this. When it goes above a certain number, it is hurting your artery. So if you look at atherosclerosis and what is causing that, it's the spikes in your sugar that are causing that. And so you don't want those to happen. So there are lots of things that you can do that have nothing to do with medication. If you walk after a meal, that's been shown to blunt the sugar spike. There was one study that looked at if you walk for 30 minutes a day versus 10 minutes after every meal. 10 minutes after every meal did much better for blood sugar than the one-time 30-minute walk. Eat complexity. That means eating protein and fats and things like that. A lot of people tell you to preload, so eat the protein and fat first and then eat the carbohydrates second. I can tell you during my experimentation, because I love bagels, if I eat a bagel with cream cheese, I still spike. If I eat a bagel with an egg, I don't. And so that higher protein of the egg helps my blood sugar response. Metformin helps with it. The GLP medications help. Probiotics. So you'll hear a lot of people in the biohacking space talking about your microbiome, probiotics, prebiotics, all of those things. Turns out there are certain strains of bacteria that help with glucose and insulin resistance. And so our probiotic that we made here, we made specifically with those in it to try and help people with their blood sugar control. So anyway, so there are things that you can do that are really going to help with that. Hormones, I'm not going to talk about much because Dr. Bluvis will give a talk about that, and she knows way more than I do. But I think that it's a very important thing when you are talking about hormones that most women after menopause should probably be on hormone replacement or very much look into it. And the reason why is there was a giant study that came out in the early 2000s called the Women's Health Initiative, which basically got called off. They said it causes hormone replacement, causes breast cancer and heart disease. No one should be on it. And it turns out that study was very flawed. The average age in the study was 63, and so the data was misinterpreted a lot. And if you look at more current statistics and data, you will see that your rate of dementia goes down significantly when you're on hormone replacement. Heart disease, bone fracture risk, which is a big issue. If you are a 70-year-old person and you get a hip fracture, your mortality, not morbidity, but mortality is your age within the next year. So if you get a hip fracture at age 70, your chance of dying within a year is 70%. And that's a gross approximation, but it shows the importance of how one thing can cascade into something else, and you want to prevent it. So you need to have healthy bones. Estrogen is a very important part of that. Hair and nails and skin, again, I'm a plastic surgeon, you want to look pretty. When you are on hormones, when you go through menopause, your rate of collagen and elastin degradation doubles. So it's like every year is a dog year for you. And so if there's a way to kind of slow that, I know it sucks. It does keep me busy. I do lots of tummy tucks and breast lifts and, eyelid lifts and things because of it. And it also helps with your weight. Risks of it may cause a small increase in breast cancer. And if you have a history of clotting, the way that you do it needs to change. Patches are better than oral for that. And again, Dr. Bluvis will go into this a lot more. But they're also, the last kind of point for me with this is that there does seem to be a window that you should start hormone replacement in, and that's within the 5 years after menopause. If you read the blogs, I have some studies that are out there that show differences if you start it late versus not. So all of this gets down to kind of the more esoteric thing of what is your biologic age? Or I shouldn't say, yes, biologic age versus your actual age. And so this is kind of the key. We want, I'm not going to tell you my age, but my biologic age, I've been doing all this testing. They say it's like 10 years younger than my actual age. I love that. That means that I must be doing some things right. And so there are these places called the blue zones. And I like to bring this up because not everything is very sciencey technology. The blue zones there are 4 of them that have been studied. They're all over the world. They're really in places you'd like to vacation, actually. But they look at why do these people all live to be old? Like, what is it about them? And they found these 4 things were the things that really resonated. It was a sense of community. So they had a lot of people. It was a small town. They all knew each other. They're close to family and their grandkids and all of that. A sense of purpose. You always hear about people who are busy and they're still working, like the doctor who's 95, who's still seeing patients. There is something about having a sense of purpose that really seems to help people live longer. Eating wisely, the Mediterranean diet or a high vegetarian diet is something that you'll see, but this isn't something you can start when you're 80 and expect it to help you live longer. Again, this is something you've got to start early, so it's something to start now. And move naturally, that really is about incorporating movement into your day. So these are people who would walk, or bike or did other things. They did housework, they gardened, they did all sorts of natural things where they're moving all the time, and that helped keep them younger. You can measure some of these things now. Telomeres we talked about. There are all sorts of things to measure biologic age. There's methylation of your DNA. There's how long are your telomeres. And as your DNA and your cells are replicating, they start to have what's called cell senescence. And that means that they start to mess up. And so when they're replicating, instead of it looking exactly like the same thing, it's a little off. And then the next time it's a little more off. And your telomeres shorten. And those things all build up so that's what causes aging. That's what causes us to wrinkle and our organs to not work as well. So there are things that lengthen telomeres, that keep them longer. There are certain vitamins, B, C, D, and E are ones you'll see, a plant-based diet, and higher activity. And there was one study I read that showed those that had high activity were 9 years biologically younger than people who sat around a lot. So again, these are all, you'll see these interconnections over and over again. There are things that shorten your telomeres. Homocysteine is something that you can test to see what your level is. It's somewhat genetically determined, but you can modify it by what you do. Cardiovascular disease, getting your LDL below 70. So if you go to your doctor and your LDL is below 100, they're probably like, you're fine. Again, this is an area you can optimize, and if you get it below 70, that will help you. Insulin. So diabetes, your hemoglobin A1C less than 5. So again, these are things that you want to try to incorporate. High blood pressure, atherosclerosis is when you're clogging those arteries. Dementia and smoking are all things that have been shown. Mitochondria. So again, this was in my science of aging thing with the plastic surgery. And I will never forget seeing they had this test in mice where they somehow depleted their mitochondria. And all of these mice looked terrible. They had like sagging faces. They looked, I mean, I just wanted to, I don't know, put them into a little bed. Like they did not look good. And then they replaced, I think it was NAD, And when they did that, they all looked like Fabio. Their hair was long, they looked really vigorous, and it was all because of the mitochondria. So the mitochondria are in every cell in your body, and it's the powerhouse of the cell. It is what makes things go. And as you get older, your body doesn't function as well, and so it can't make as much of this energy. And so NAD, which is one of the things that feeds into that, is something that we can test for. So we actually test for it here, but it drops 50% by the time you hit middle age. And so some of the sluggishness and all those symptoms of aging that you feel is because your mitochondria aren't working as well. So NAD in the past, I wasn't a huge fan of it because there wasn't a way to quantitate it. People were taking all these supplements, and did it work? Did it not work? Did it feel better? If I gave you M&Ms, would it make you feel as much better as this NAD did? And then they came out with this thing called blood spot testing, where you can actually test your NAD level. So before we started carrying it here, we tested a bunch of us here, and it should correlate kind of with your age. And so it did. We did have one outlier who was a little more NAD depleted, even though they were younger. And so won't mention them. But then we tested our levels, and then we started taking the supplement that we were going to carry to see, does it work? Because one of the things I am so focused on here is that when we carry things at Biohackr, we want our supplements to be NSF certified, which is a third-party certification. When we carry a product, we spend extra, we research it, because we don't want you to wonder, is this a high-quality product? Because we've gone through all of that before you get it from us. So we then all did the NAD, and then we retest it. Because when you do something, you can't just do one test and then do an intervention and then say, okay, we're done. Because what did it do? Did it raise it a little? Did it raise it a lot? Instead of 2 scoops every day, do I now need 1 scoop? Did it not do anything and I need 3 scoops? So you need to figure out what's happening with your body. And again, everybody is different. So I can tell you, when I started the NAD, I felt better. I felt like my premenopausal self, is what I like to say. And if you look at studies in NAD, because it was hard to quantitate, there aren't a lot of scientific studies in people. There are lots of them in mice. And what you will see is that heart and blood pressure got better. You will see metabolic conditions, which are things like diabetes, improved. Muscle endurance. They found that it restored fertility in some of the mice. So that it affects all of your body systems. And so if you're trying to find a way to kind of improve everything at once, NAD is a good place to start. And the oral form is a better way of building your NAD levels. Another thing is building muscles. So this is something, when you go to the gym, and I go to the gym and I see all these 65-year-old women who can absolutely beat me. And I thought, why are they all pumping iron? Like when I was growing up, thought I need to do aerobic exercise. I need to run and ride my bike and do all this for my heart to be healthy. And that's true, and you should still do that. But building muscle is super, super important. And the reason is that it helps prevent dementia. There's a correlation. The more muscle you have, the lower your dementia risk. There is correlation between that and your bone strength and density. You don't want to fall, so it helps you with your stability. It helps with blood sugar. So again, this is something where building this is going to affect a ton of body systems. Creatine is something that you can take. It's a supplement. This is another thing where I always thought creatine was kind of for 20-year-old bros in the gym, and I'm not a 20-year-old bro in the gym, and I don't want giant muscles. But it's something that occurs in you naturally. The source that you get it from is from meat and fish. But what happens as you age is you make creatine in your body, but the amount that you make, of course, because this is aging, goes down as you age. And so you're not probably keeping up with it as much as you need to, so your creatine levels go down. Why do we care? Creatine helps make ADP turn back into ATP. ATP is what your mitochondria use to make power. So just like NAD is helping the mitochondria, creatine is helping the mitochondria. Who needs it? Anyone who is vegetarian or vegan, because the biggest diet source is meat. There was one study that I found, and again, I cite studies, and I apologize if it's annoying, but I like science. And so it's one thing to say you should take creatine. It's another thing when they've studied it and showed that it does things. And if you can give something to a pregnant woman, it's got to be pretty safe, right? And so they showed that vegetarians or vegans had less low birth weight babies and less preterm labor when they were given creatine while they were pregnant. Weight loss patients, a huge issue that we're having with a lot of these GLP medications is that they lose more muscle than they lose fat. And we don't want that. We want to keep the fat. We want to keep the muscle, lose the fat. And so giving creatine to people helps them preserve that muscle mass. Menopausal women, you need to build that muscle. It helps elevate your basic metabolic rate. It helps prevent you from getting hip fractures and things like that. It helps prevent dementia. And so you really need it. Men over the age of 50, some people like to call it menopause, but you also are having hormonal changes. It's not as evident as it is in women, but you're still having that. And then anyone who wants to just improve their muscle strength and their endurance.
And is that red meat or just turkey, chicken, whatever?
So I'm sure there are different levels and different things. I don't know the answer to that. But meat is the source, which is why that vegetarians and vegans have issues. But it has to be that animal protein. Creatine is not all created equal. Again, I read a bunch of research papers, and there was one paper that looked at creatine that they got off the internet, and they analyzed it to see what was in it, were there any contaminants in it, and they found there were a lot. There were some that had heavy metals and other things in it. So they recommend German creatine. So we import it from Germany, and it's German creatine powder. The powder is the most stable form. I love a gummy or some other form of taking these, a drink or things like that, but that's not the stable form for creatine. So this, you take a powder, you mix it into a liquid, you take it every day. One of the things that I also conflated in my own mind, I'm a doctor, you would think I'm really smart about these things, but I always thought creatine was dangerous. I thought, it could cause kidney issues or, do all these other things. And it turns out in my head, I was equating creatine to steroids, and they are radically different. So if you look at the risk profile for creatine, if you have a kidney disease, there may be a reason to not do it, but otherwise pretty much everyone can. Again, they did a study in pregnant women. And to have it really be effective, you have to pair it with resistance and strength training. So this isn't something where you take the powder and suddenly you have giant muscles. You have to do it with the training to get that benefit. So in summary, there are basic things that you can do. Some of them are lifestyle things. Some of them are just figuring out what your issues are. Is it heart disease and cholesterol? Is it cancer? Is it blood sugar? Do you need to start going to the gym? There are basic things that you can be doing, like just increasing, think of the blue zones, community, sense of purpose, movement. Those are all things. Doing a simple thing. I gave this talk to a bunch of women for one of the groups that I'm involved with. And then I was walking my dog, and I saw one of the women come up to me, and she goes, "We just ate dinner and we're walking." And I was really proud of that, because if she gets into that habit now and she does it for the next 20 years, she's going to be a much better 70-year-old. So that's it.